All right, so we have a lot to cover today, so we'll try to move through this quickly. Thank you again, everyone, for coming, our live audience also. My name is Christina Waymink. I'm the Department of Public Health I'm the Ottawa County Department of Public Health Information Officer. And again, I want to thank everyone for attending our daily briefings. We will keep holding these until further notice. I know there's a lot of information we want to get through, keep the community informed, and I know there's a lot of different questions. So I appreciate your patience, and we're very thankful for all of our community members taking their part in supporting us through this effort and everyone doing what they can to make sure that we're working through the community mitigation strategies, as I know they're difficult in everyone's life at this time. So let me move forward then to introduce the speakers. We're going to have Al Vanderberg, our Ottawa County Administrator, speak on operations update. Jessica Vingenoven from our Ottawa County Parks, she's our Communications Manager. She's going to talk about some parks updates. Lisa Stefanowski from our Health Department, she's our Health Officer, going to cover COVID-19 response updates. Nick Bonstell, the Director of Ottawa County Emergency Management, some more updates on their coordinated response in the county, and then Captain Bennett with Ottawa County Sheriff's Office, some other law enforcement operational updates. All right, I'll turn it over to Al now. Thank you.
Good afternoon and welcome. I'm Al Vanderberg, Ottawa County Administrator, and I thank you for spending this time with us once more today as we update the community on the actions of Ottawa County in regards to the COVID-19 situation. Ottawa County has been balancing its responsibility of providing high-quality and necessary public services with both its obligation to help prevent the spread of COVID-19 in the community and to protect the health of its 1,100 employees, including our emergency responders. Up to now, we've made changes in operations to limit non-essential person-to-person contact. Today, we're announcing that at effective 5 p.m., we will close Ottawa County buildings to the public. Despite this, though, we will continue to fulfill as many of our obligations to provide government services as possible. We encourage residents to visit our website at myottawa.org/closures, that's myottawa.org/closures, to access services online, and also to learn how they can do business by phone, email, or other means. myottawa.org has been growing exponentially over the years, and we have a huge number of services and a very large number and a large amount of growth each year in those who access services by that means. Also, we will be putting direct telephone line numbers out so that people can easily access the various offices, courts, agencies, and departments to access services. And then in some cases, we'll even have services available by appointment. We will remain fully staffed, and because there's customers who need us, we will make accommodations for many urgent needs. We have so many things we provide, personal protection orders, community mental health, which will remain open to meet those very critical needs that exist every single day in our community. As you all know, the only constant about the coronavirus is change. This change occurs on a daily basis and even many times per day, as we've seen. Sometimes it's hard to believe this all really started on Wednesday last week. It seems like it's been a lot longer than that, quite honestly. We will regularly continue to evaluate and update this decision and our operations as this situation continues to unfold. Changes in procedures will be posted at myottawa.org/closures, so please check this information on how to access county services before venturing out of your homes. Our county is blessed in many, many ways, and this too shall pass. Thank you.
Hi everyone, my name is Jessica Vangenhoven. I'm with Ottawa County Parks, and I'm here with some good news today. Our parks and trails are open. We want you to get outside, but we want to remind you that visitors need to be safe while they hit the trails. Hard surfaces such as playground equipment, handrails, benches, those sorts of things are not disinfected. So this is your reminder, probably your 100th of the day, to be sure to wash your hands before and after you visit parks. It's also important to practice social distancing even while you're outside. We know that can be difficult at some of our busier parks, such as Rosie Mound and Grand Ravines. And we would encourage you, especially at those parks, if the parking lot is more than half full, consider exploring a new park that day. We have over 40 properties. You can find those online at miottawa.org/parks. An update as of today is that all of our restrooms, including pit toilets and our rental facilities, will be closed. They will remain closed through April 10th. We came to this decision because of a combination of changes to personal protective equipment for employees who clean and sanitize restrooms based on some CDC recommendations, and also just the increased demand for sanitization supplies and a decreasing supply of those supplies. So we want to keep everyone safe, and we're just not able to provide the cleaning standards that we should at this time. Our nature center will remain closed, and that means that all of our indoor and outdoor programming is canceled through April 10th, but we're piloting Bringing Nature to You. We will be doing some online programs as well as some Facebook Live, so we hope that you can check them out and join us. You can find us on Facebook at facebook.com/Ottawa County Parks. We really think it's more important than ever as cabin fever sets in to get outside and get some exercise. We just want to make sure that you are safe while you enjoy the trails. Thanks.
Good afternoon. I'm Lisa Stefanowski, Health Officer for the Ottawa County Department of Public Health. I want to assure everybody in our community that the Ottawa County Department of Public Health has a team of experts on the job 24/7 working on our community's behalf. We are working hard to provide transparent education and information that you can use to effectively keep yourself and your family healthy. And we're also working very closely with our community partners to ensure that your needs are being met. We know that this is a very difficult time. People are out of work, people are worried, people are nervous about going places. We're working with those partners to address some of these concerns and make sure that you have opportunities for activity and food and the basic needs that you need during this difficult time. I'm going to start today also with some of the statistical numbers that I can provide. We have sent 92 tests to the state lab so far. We have had one positive case or one positive lab result, which resulted in our first case. We've had 36 negative results come back. We have 55 cases pending. Those are cases that have been sent to the state, or labs that have been sent to the state, and we're waiting for those results to come back. And when we do, those results will be posted on our website, and you'll be the first to know. We've investigated a total of 67 contacts associated with our one positive case. 54 of those we consider to be medium-risk contacts, 13 we consider to be high-risk contacts. A high-risk contact, an example would be a close family member where they're exposed to each other all day on an ongoing basis for prolonged periods of time. I also want to talk a little bit today about testing, isolation, and clearance from isolation once a person is no longer at risk of spreading the virus. Once someone has a confirmed laboratory test for COVID-19, they are notified by the Public Health Department. They're provided with education about preventing the spread of the disease to others, and they are confined to their home. We call this self-isolation. This is very important. Self-isolation means they are not allowed to leave their house because that would put others at risk for getting COVID-19. While the case is in isolation, our department works very closely with that case. We contact them daily. We are making sure that they are self-monitoring. and providing them with education and guidance to ensure that they're not spreading the disease to others. Once they're kind of working their way through this virus, we can talk about release from isolation, and that can be done in two different ways. One of the ways is to look at time and symptoms. And what that means is based on the amount of time that's passed from the start of symptoms and the amount of time that's passed since the resolution of symptoms. Now, you might have some questions about that, and when we finish, I can defer to our communicable disease expert who's here today. The other way that we can release someone out of isolation is to retest them. And based on a negative test result and being symptom and fever-free, we can release them back into the community. Our main goal here is to make sure that someone is still not able to spread COVID-D in the community. And we work very hard to make sure. For our current case, we're right now in the process of kind of figuring out which one of those two options would be best. So more to come on that. Also want to talk a little bit about why health departments across the state may or may not release the public locations where a positive case may have been. First, at this point for Ottawa County, that is just not the most effective way it's not the most effective preventative measure. We have evidence to assume that COVID-19 is in the community among people who have not been tested and may not have symptoms. We currently, as mentioned, notify every single close contact of a confirmed case based on the information that we collect from interviewing with the case. We want to prevent unnecessary public worry, since the current standard for potential transmission is being closer than 6 feet. And people are wanting to know where the person has wandered around the community, and that's just not the most effective way for us to prevent the spread of disease. We also don't want to stigmatize common public locations if there's no risk associated with those locations. This is very important. People should treat every location in the community as a potential exposure. Now that we know COVID-D is here, we need to be using those preventative measures all day, every day, wherever we go. We will and would disclose those locations only if there was a specific, actionable, preventable reason that would help prevent and mitigate the spread of this disease. So, we really believe we're using good science here, and we want to kind of put a lid on unnecessary fear among our public. I can tell you that we are following up, we are providing you with good scientific information that is effective in mitigating this disease. At that point, I'd like to turn it over to Nick Bonstall, our emergency manager, for further comment.
Thank you, Lisa. So, our top priority at this time remains acquiring and distributing personal protective equipment out to our frontline staff as our emergency responders. The nice thing is some of this we are starting to see a little bit of progress on. We have been notified of a first very small shipment to some of our coalition partners, and we're working to distribute that, and we do expect some further PPE distribution in the future, although the amounts are unknown. The other things that we're doing is supporting local hospitals and trying to provide and resource external supplies like tents, heaters, things where they can set up external referral test areas. So we're supporting those operations. One thing that you guys will see a lot of from this point forward, especially with our first response agencies, whether it's a law enforcement or a fire area, the buildings will really be shut down to the public. And we once again just plead with you, if there's administrative issues or something non-emergency, please reach out to those departments through technology. There's a lot of phones and email and video conferencing we can do. They're very much still out in the community responding to 911 calls, but we need to protect them as much as possible to keep that stood up in our community. One of the really bright spots out of all of this is the community effort that is being handled right now by the United Way and Community Spoke. Please visit careottawacounty.com. It's a very nice website that they put together very quickly, and you can either volunteer, donate, or request assistance on that site. And we definitely also ask that for any resource requests out in the community to dial 211, and they are 100% staffed, ready to go. We are fully supporting Community Spoke and their human services coordination, and it has been a great coordination here in the county. Some of the other things that we're just thinking about that we really want to get out message-wise is, just because everyone's shut in and away from each other doesn't mean that you can't still have that community response. So using that technology to still check on your neighbor like you have in the past. So instead of a face-to-face interaction or a knock on the door, it may be a phone call or an email or a video conference. So along with that, some of the other things that we want to push are taking breaks from all the media coverage and all of the reading specifically just towards COVID-19. That mental health aspect is huge, and we see that, and we think that taking a break is a good thing. We encourage everyone to stay connected through technology. Like I said, the video calls, instant messaging, emails are just a great way to stay connected with people out in the community, and we encourage people to once again get appropriate sleep, manage stress, and stay healthy. So overall, continuing on a daily basis, we'll continue to update the public with what we're doing within the Emergency Operations Center, and it is a very strong, coordinated community approach that we're taking here in Ottawa County. Thank you.
Thank you, Director. Captain Mark Bennett from the Sheriff's Office. Just a couple quick notes as it relates to a law enforcement update. I'll be brief. First of all, the Sheriff's Office in all divisions remains fully operational, and we don't see that changing anytime soon. One thing I'd like to point out, in light of the County Administrator's notice of the building closures, almost all of the services that you could obtain here at the Fillmore Complex can be accessed either online, or instructions on how to obtain those services are online. myottawa.org, the Administrator described that. Also, phone numbers exist, and they'll be available on the Maine County's website too. So I want to reassure the public that. Two quick things from the law enforcement front. One case in particular, last evening we responded to a business in Holland Township that was thought to be in violation of the governor's order of operation. That turned out not to be the case. That business was doing takeout, so there was no areas of concern. That was very readily rectified. And then also, our patrol deputies did notice in the last 24 hours that because of people being out of work and out of school, there's congregations in common areas, around down streets, and it seemed to be in kind of violation of our social distancing guidance. Okay, not really a law enforcement issue per se, but just as a reminder to the general public to observe the social distancing guidelines and enjoy the outside, enjoy the parks as we heard today, but keep in mind those distancing guidelines. And then calls for service over the last 24 hours have been largely unremarkable. So that's it for the update. Christine?
Thank you, speakers. I will now open it up to any questions. All right.
Captain Bennett.
Oh.
Just real quick. Captain, are you deputies worried about contact with people? I know some departments around the country are kind of trying to get them less contact with the population.
So I think I talked a little bit yesterday, and the sheriff spoke the day before about some efforts that we have already embarked on in some phone call return of for services by a phone, if we can do that. Also some limiting distance-wise, if we can, when we do have to respond to calls. So, but the nature of our job is sometimes we do have to get in close proximity, and we've been working with the emergency management director for the PPEs and those type of things. So we've sent out guidelines to our staff multiple times over the last few days. So yes, it's a concern, and yes, we're addressing it.